A psychiatric assessment is quite a structured assessment. First and foremost, we want to understand why you're here and what's been troubling you the most. But generally, most people, it goes much broader than that. People have, they may have had mental health problems in the past. They may have had medical problems in the past. People come from families, so we want to understand about, what your family was like and what it was like growing up. What were your experiences at school and how are you coping, in working life? Some people have problems with addictions, with drugs or alcohol. Other people, there are aspects of their personality that are troubling them. They constantly get into the same difficulties. I think also we just want to know where you are right now. How are you feeling today? And we might get you to fill in some questionnaires which might help us disentangle some of the things that are going on for you and specific things that are troubling you in particular. So on the back of that, hopefully we can begin to bring things together in some kind of formulation that might include a diagnosis, but covers things that might be very medical, might be very psychological, but might actually be more around your lifestyle or around the social world you're living in. So on the back of that, we can hopefully make a plan specific to you. And that might include, things as medical as blood tests or brain scans or prescribing certain medications, but it might be other things such as seeing a psychologist or a psychotherapist or just continuing to talk to a psychiatrist. We might think about, how things like, are you getting enough sleep? Are you getting enough exercise? Are you, how are things in your relationship? Are there changes you want to make in your job, for example? And then I suppose the question we'd have to answer is, how close a follow-up do you need? So some people, they might come back weekly. Others, they don't need that quite so much. They're looking for an assessment and then maybe, they might want to come back once or twice. And some people, of course, do keep coming back for a long time and things carry on. And it's nice to be known sometimes in a clinic like this, a place where you don't have to repeat it all again to another person. And hopefully, collaboratively with you, we can work out what suits you.